What to do about jaw pain and neck pain and migraines and all the other craniofacial pains? Like, really, what do you do about them? I've had some minor jaw pain in the past, mostly from clenching due to stress, but never anything that resulted in chronic pain. However, craniofacial pain, including TMJ disorders and migraines, are so common. So I was interested in the question, are there holistic ways to treat them? This week's guest is Dr. Dave Shirazi, a dentist who specializes in this type of chronic pain. Get ready for another episode of Chronically Living. I'm Kelsey Harris, a chronic illness warrior and a psychotherapist in training. On Chronically Living and How to Make the Most of It, we're providing tangible ways to improve the well-being of spoonies. So get ready to make the most out of your life, even with that pesky chronic illness.
Hi, my name is Dr. Dave Shirazi. I'm a dentist, I'm an acupuncturist, and I have a couple practices in the LA area, one in Brentwood, one in Thousand Oaks. And my focus is on helping people get out of chronic pain, head and neck pain, treating or resolving snoring and sleep apnea, or doing a form of orthodontics called functional orthodontics.
We're going to get into the specifics of all of this in a moment, but first, I was curious as to how Dr. Shirazi got into it all. Most dentists I've met don't specialize in all of these things.
Well, my mom's a dentist. I mean, everyone in my family is a doctor or dentist, really. And I assisted my mom when I was like 14 years old. And of course, she inspired me. And I love working with my hands. And I love talking to people. I'm very chatty. So it was very easy to connect with patients and with people that way. And I love learning. I was always a big nerd. And when I was 18, I had a cold. And my mom, being a neurotic Jewish mom, told me to go to the doctor, right? So I go to Kaiser, and there is like a room full of really sick people, hacking and coughing. And I said, forget this. I went home. I came back an hour later. They brought me in and they gave me antibiotics. And just picking up on things that my family would say, I said, so this problem's in my nose, right? He goes, yeah. I said, well, if it's in my nose, it's a virus, right? He goes, probably. I go, well, then what's the antibiotic going to do for the virus? And he said, well, the antibiotics will focus on the bugs in your immune system, in your body, so that your immune system can focus on the virus. I go, okay. I told my mom, and she's in that genre where you just do whatever the doctor tells you to do. You don't question it. So I took it. I got better. And like I said, I was a bit of a nerd, so I looked it up in the library. This is before the internet. And and I found out that even back then, this is what, I was 18. This is like 1991. We knew even back then, you're not supposed to give antibiotics for viral disease because you could, form a resistance to it. So I was very skeptical about traditional medicine because of that, allopathic medicine. So I had decided that after dental school, I would learn something holistic that I could do just for the purposes of like being a parent, being a husband. Just I wanted to learn something. And then I studied Shaolin martial arts, and the instructor very much pushed me to study Chinese medicine. And I did. As soon as I graduated dental school, I came back to LA and got my master's in Chinese medicine.
Dr. Shirazi isn't your typical dentist. We know that in addition to dental school, he studied holistic approaches, and he specializes in working with people who have chronic pain.
So when I went into dental school, my favorite part was surgery. I enjoyed surgery. And I got in, and they would show the lateral ceph x-rays of these post-TMJ surgeries. And they had all these bolts all over them, bolts and screws. And I tell them, I go, how do these people function like that? And they're like, we don't know. I go, well, what do you mean? You're doing the surgery. He goes, these people don't have very many options. And this is like, they're throwing the book at them. They don't know any better. It's very maverick type work. And I was so disgusted by that. I didn't want to do that at all. So I came back, and my mom was always pushing me to do orthodontics. And I thought, okay, well, I love that. So I took a lot of continuing ed, and I was really enjoying it. And I didn't know, this is over 20 years ago now, the majority of us didn't know that the relationship of sleep apnea in children. So we now know that sleep apnea can cause almost every disease you can think about in a child. But the most common and well-known are ADD and ADHD, bedwetting, behavioral issues, neuralgia type problems. So in any event, when we were doing the functional orthodontics on these kids and requesting tonsils and adenoids to be taken out, we were getting all these profound, changes. The parents would come back and would say, yeah, he's doing great in school now. He doesn't argue with me. He's just great. And it was very rewarding, much more rewarding than doing conventional dentistry. And I love conventional dentistry. It's not like I gave it up because I was a frustrated dentist. This is much more enjoyable to me. And then the parents would say, hey, can you do that stuff on me? Can you treat, what you did for my kid on me? And I thought, well, I think so. Let's give it a try. And right around that same time, I got into the clinic in acupuncture school. And all throughout the didactic training, they would talk about all these things that you could cure or resolve or greatly improve with acupuncture or herbs. And I just remember being so skeptical about it at the time, like, okay, well, come on now, don't be exaggerating, And then when we got into the clinic, I actually witnessed it with my own eyes, and I was blown away. And I had patients who would come in. They were basically like Vietnam veterans. And they're like sitting there in the chair with their arms folded, saying, I didn't want to come here, but my daughter made me come. So I'm going to give this try, whatever. and, either me or my mentors would do acupuncture for this injury they had for like 40 years. And they would say, moving their shoulder, it's not 100% better, but it's almost 100% better. It's like, okay, so, my eyes got big, and then I was able to combine that with the training I had prior, and I just got really good results.
I'm personally a fan of acupuncture. I was skeptical when I started having it done for my chronic pain because I had it for an ankle injury back when I was a teenager and it didn't really do anything for me. But like Dr. Shirazi's experience as a practitioner, my eyes widened as the patient's when I started to see results in my adult experiences with it. Dr. Shirazi gives us an overview of some common chronic pain disorders that he treats. So if you have one of them, TMJ disorder, chronic migraines, trigeminal neuralgia, or other craniofacial pain, listen up.
So the name TMJ is just the name of the anatomy, right? The T stands for temporal bone, the M stands for mandibular bone, and the J stands for joint. A TMJ disorder can range from just pain, like inflammation, swelling, we call it an effusion, to clicking, to locking, to arthritis, to severe pain. Even on rare cases, there can be cancers, usually metastasized cancers. The nerves that supply that apparatus, the temporomandibular joint and the surrounding structures, is profound. And there is a phenomenon in neurology called central sensitization, which basically means you have a chronic injury, you don't address it, and your brain actually goes through physical changes, what we call plastic changes, and it then starts making other parts of your body either hurt or behave differently.
Okay, so our brain changes due to chronic pain. That doesn't really sound good to me, but as Dr. Shirazi points out, our brains are actually designed to change because of the plasticity.
Okay. And those are much harder to diagnose. So, for example, all migraines are centrally sensitized, trigeminal disorders. There's all these studies that show a correlation between someone with migraines and a TMJ disorder. And a lot of them are case studies because, there's no money to be made. And they'll find the overlap between both tension type headache and migraine type headache and TMJ disorders is very, very high. And then when we take that population that's got both, and then we resolve the TMJ disorder, we see a huge reduction in either their tension type headache or their migraine type headache. So it's interesting because some people don't respond, and we don't know exactly why. Because human beings are complex creatures, right? You could have gut allergies, you could have a hormone imbalance. There's so many reasons why someone might have a disorder. I sure wish it was more common knowledge that your tinnitus could be caused by a displaced TMJ joint, your ear pain, your tension type, migraine type, your neuralgia, like trigeminal neuralgia and other facial neuralgias, can be strongly correlated with your TMJ disorder. And if you fix it, boom, that'll lead to improvement in the other centrally sensitized disorders.
Right. Okay. And probably most people have no idea that that's the case.
Most doctors don't know. See, that's the problem. I graduated dental school in 2000, immediately started practicing. And in dentistry, there was a joke that every dentist that's fresh out of dental school is about 7 years behind. And I think that's conservative. I think it's more than that. And research doesn't always find every single doctor. There's so much research. So having someone that knows it all or that is versed with it all is almost impossible, right? So when you come out, and then the physicians forget about it. I mean, most allopathic physicians are trained to give a diagnosis, and then unfortunately, a common treatment methodology is just drugs or surgery. And some drugs do cure it. So for example, we know that penicillin will cure bacterial pneumonia, insulin for type 1 diabetics. I mean, these are things that save people's lives every day. But the vast majority of drugs are really designed to just manage symptoms, right? Which are useful in the context of, well, let's manage it until we figure out why you have the problem. But unfortunately, most of the people I meet and most of my patients were given a pharmaceutical with the intention that they take it for the rest of their lives.
Does this sound familiar to you? Because it sounds familiar to me. But if our medication is just meant to manage us, not improve things, what are we to do?
The first thing is to just be aware if you have a problem, right? So, for example, if you wake up in the morning with sore muscles, right, dry mouth, and maybe even eventually start clicking your jaw, all of those things are not terrible disorders, but they're warning signs that you should do something about it. You're clenching your teeth at night. I was part of a very large study, almost 1,200 subjects, where we took people that had TMJ disorders and we quantified it, right? Whether we did a CAT scan, MRI, whatever we did. And then we took those same people and we did sleep studies on them, whether they were in home or in lab. And what we found was among almost 1,200 patients, we saw a direct ratio in the severity of their sleep apnea and the severity of their TMJ disorder. And you might think, well, why are those two things even remotely related? Well, we found out a little over 10 years ago that half the time, roughly, depending on which study you look at, the reason why we clench our teeth is because of poor airflow in our sleep. In an overnight sleep study, we have like 20 leads on the patient. We're looking at their oxygen, brain waves, muscle activity, airflow, thermistor. And what we found was half the time when their airflow started to dip, their muscle contractions and their masseters went up. And then when their airflow was restored, then their masseter activity just dropped. And the other 50% of the time, we didn't see a direct correlation about anything we were measuring to, their clenching. So that's meaningful. That's meaningful. And the other thing we know about sleep apnea is that untreated, as you get older, it gets worse. Right? So if you were clenching your teeth a little bit when you're 17 years old and just occasionally having jaw pain or headaches, by the time you're 30, you're going to clench a whole heck of a lot and be in a much more worse condition. So that just having the awareness of those early cues and saying, you know what, I should at least do something to protect my jaw.
I found this next part of the conversation very interesting because I have an ex who was diagnosed with TMJ disorder and was given a night guard for it. But was that the best treatment option?
You would go to someone who just limits their practice to this. So in dental school, they teach us night guards, which I'm sure everyone knows what a night guard is by now. And night guards are really designed to protect the teeth and to protect the dentistry. And that's a very useful feature, by the way. I'm not downgrading that. However, what we find is they do no favors for your jaw positioning, or your clenching for that matter. A couple of other studies came to light, which is very fascinating, where they took patients that had sleep apnea and they couldn't tolerate the CPAP, and they were clenching their teeth, and they gave them a night guard. But here's the caveat: they did a second sleep study on them with their night guard.
Okay.
What they found was, again, roughly half the patients, their apnea got more severe with the night guard without, untreated sleep apnea, and they clenched a lot harder. And then, what happens is when you sleep on your back, your jaw falls back. When you sleep on your sides, your jaw falls to that side, and then you sort of clench and gnash at your teeth at that position, which is not natural, right?
Mhm.
And then you compound it by someone having loose ligaments, like a lot of athletes, gymnasts, cheerleaders, they have very loose ligaments, so their jaw will go to all sorts of directions when they're trying to clench.
I think we have a pretty good overview about TMJ disorder now, but what about some of the other types of craniofacial pain out there?
So like we were talking about earlier, so jaw pain, tension type headaches, migraines, we can talk about the aspect of how our maxilla, our upper jaw, it's the roof of our mouth, but at the same time, it's the floor of our nose. So when we develop on the maxilla, when we expand the jaws, we actually get an improvement in nasal breathing. We also get a huge improvement in facial cosmetics because the maxilla articulates with 8 pairs of bones and the septum of the nose. So when you're developing those arches, you're just kind of pulling your face like outward in that kind of standard European good-looking face, that's craniofacial pain. Like, so for example, the number 2 cause of ear issues, ear pain, ear congestion, tinnitus, things like that, are TMJ disorders. Number 1 being infectious, number 2 being TMJ disorders. Because, your ear is right here and your jaw is right in front of it. There was a great paper written, I think 40 years ago now, by a physician called TMJ, the Great Imposter, where he had just observed over years and years of clinical practice, so many people came in with ear problems, headaches, anything you can think of, neck pain. And, he would just out of curiosity would ask him if they also clenched their teeth or had clicking or had jaw pain, muscle soreness. And more often times the answer was yes. And the literature supported, what he observed.
Okay, so my takeaway from all of this is that if you have any type of craniofacial pain, start with some awareness of what's happening with your jaw and maybe get it looked at first, because in many cases it seems that fixing TMJ problems will help fix all these other ones.
Just having the awareness, finding the right person to work with and be your doctor and kind of listen to you and what you have going on, and realize that, your head is not separate from your jaw, which is not separate from your neck, which is not separate from your sacrum, which is not separate from your gut, which is not separate from your hormones, and least of which your psychology. That's also a big part of it. Right. So one thing I always invite, I was just telling a patient today, one thing I always invite people to do is to take what's called the Metaposition. This is just a general suggestion to life. And a Metaposition, like when we do a meta-analysis in research, we kind of look at everything that's there and then we step away from it and kind of look above it and go, okay, so what does this look like that's happening here? Right? Like when we observe ant behavior or spider behavior or shark behavior, we take the Metaposition, we step back, we observe, and we see if we can draw any conclusions because of common repetitions. So one thing I'll tell people is that in Hong Kong, it's considered polite to burp at the dinner table.
Okay.
It means you ate fast, right? And because you ate fast, you got air in your stomach and then you had to burp. Right? It's such a well-known thing that kids will fake burp at the dinner table to let the mom know that it's yummy. And of course, here in the West, we would find it rude and disgusting to burp at the dinner table. So if we take the Metaposition, we can conclude that burping at the dinner table doesn't carry an intrinsic meaning. It is a neutral event.
Mm-hmm.
right? And it is our choice to respond to it as either a positive or negative thing. It's always there. Everything is neutral.
What Dr. Shirazi calls the metaposition is what I refer to as the observer self or the noticing self when I'm working with clients during psychotherapy. It might seem a bit strange to have this conversation when we're talking about chronic pain, but it's not. We can learn a lot about the pain and about ourselves by taking this step back. Here's a really good example of the neutrality of, well, everything.
So if we extrapolate to the whole planet, there's 2 billion people on this planet who believe that eating pork and shrimp is dirty and sinful.
Mm-hmm.
Right? And right next to those 2 billion people, there's another billion people or so, a billion plus, that believe, well, pork and shrimp is fine. You just can't have cow.
Right.
No beef. Okay. And then there's about 3.5 billion people that say, well, you can eat any animal you want, just not on certain days of the year. And then there's another 0.5 to 1 billion people who say, well, you shouldn't eat any animal. So if we take the meta position, we can conclude that eating or not eating any animal any day of the year doesn't carry an intrinsic belief to it. It's a neutral event, other than the fact that you are most of the time technically killing it.
Right.
People have gone to wars over these kinds of beliefs. And it's our choice how we want to respond to something as opposed to react. So the word react means reacting. We're just taking an action that we've done before, pre-programmed, and just rehashing it over and over again.
Mm-hmm.
Whereas with the response, we can take a moment, take a meta position, and go, okay, so not just for the situation, but for my overall well-being, okay, what's the best way for me to handle this?
So, my question to everyone listening is, do you react or respond to your chronic pain?
And I'm very pro-therapy, by the way. I wish people would go see a therapist and talk about what's been bothering them. Don't keep it a secret. Don't hold it in your stomach. Just let it out.
Remember that all specialists have different training. Your GP or another physician has different training than Dr. Shirazi as a dentist or myself as a psychotherapist, which is why I always advocate building a healthcare team.
I'm talking to so many physicians. Oftentimes, they're so smart and they're so knowledgeable, but they're not trained to think in the context of what are the known causes of this that the patient is coming into? What is their lifestyle like? Are they getting sleep? For example, like I mentioned earlier with children, I don't know any disease in adults or children that isn't either directly caused by or indirectly accelerated by lack of good sleep. Coming back to that, to medicine, the thought process is mostly, okay, well, how do we manage the symptoms that patients are coming in with today? Which in an emergency situation, that's exactly what you want. Most diseases are progressive in nature, including psychological ones. And having something that we can intercept the disease, intercept the lifestyle, intercept their sleeping patterns, we can have really powerful effects as opposed to waiting until it's so bad.
Okay, time to start wrapping this up. I find that there are always some good insights in these lightning round questions, so let's hear what Dr. Shirazi has to say. What are the top 5 songs that describe your life?
Describe my life. Well, my favorite song is Symphony Concertante by Mozart.
Oh, nice.
And if I had to describe that song in one word, it would be beautiful. It's just a beautiful song. It played on my wedding, and my wife is walking down the aisle. I just love that song. And my life is beautiful. I'm so grateful for the people in my life, my staff, my patients, my 8-year-old, of course, my wife, and the people I've been able to help and hopefully continue to help.
Oh, that's amazing.
Mm-hmm.
Love that. What's one thing you can't go a day without doing?
I don't know, my mood changes. Like some days I gotta have my coffee, other days tea, other days I don't want any of it. I love driving, like sports car driving and a track or canyons. That to me is like, I'll do that just for the hell of it. I don't need a place to go. I'll just do it for the heck of it. I guess, you know what? I cannot not kiss my son's face and bite his cheeks. So if I didn't do one day of that, it would probably not be a good day.
Yeah. Amazing. What's one thing you plan on doing in your life that you haven't done yet?
Travel to space. I would
Nice.
absolutely love that. I love traveling in general. I love meeting new people. I've traveled a lot, but there's so much more traveling I want to do.
Mhm. Yeah, me
Mhm.
too. I love traveling. It's the
Mhm.
best. Describe your perfect day.
My perfect day. Oh, well, I'm probably hiking in the Sequoia, and just surrounded by the giant redwoods. And I have a delicious meal, breakfast, lunch, and dinner. And the next day I end up losing a couple pounds. And I get to be with my family and I get to help people. That'd be a great day.
Awesome. How do you inspire your patients to make the most of their lives?
Well, kind of like what I was telling you about earlier, about taking a moment to just take invoice in their thoughts, in their environment, and what have you. There is a book called Man's Search for Meaning.
Just finished reading that.
There you go. There you go. Viktor Frankl, right? He came up because he's German. He had to be a formula, right? He came up with a formula that said between stimulus and response, there is a space. And in that space, you can choose. You can choose how you want to feel about it. You can choose how you want to be with yourself.
Yeah.
Right. So that is something I trust me, I do not want to be a therapist. God bless you for wanting to be one. I don't know how you all do it. I just want to give them a hug. I wouldn't know how to deal with their problems. Right. So what I can do is just kind of just leave them with a pearl and
Yeah.
just let them do with it with what they might on their own time.
The book Dr. Shirazi is talking about, Man's Search for Meaning, is one I highly recommend reading. And what he just said about the choice we can make, it can feel really difficult when we have chronic pain to see the choices available to us, but they are still there. Part of using that observer self or metaposition is being able to notice the choices available and to use that to respond rather than react. Just finally, where can we find you and follow you and all that?
Right. So the easiest way is my website, tmjla.com, which is also the same as TMJ Conejo, CONEJO.com. And we have a lot of knowledge on there, some podcast recordings. I'm sure yours will be on there.
Awesome.
And just a lot of information that people can arm themselves with. And yeah, that's the best way. And if they want to find someone in their own area, there is a website called TMJ Therapy Center, which is the center is spelled CENTRE.com. And you can go to the patient portal and you can just type in your zip code and they'll find you a local doc. My two offices are like 2 out of 65 throughout the world, maybe more by now, I don't know. But we're all over the US, Canada, England, Bahrain, Dubai, Australia, New Zealand. And these are people who are very like-minded, like myself, and who use the techniques I use. There is one other one that's also an acupuncturist, but so far just two of us.
Okay, nice. That's awesome. That's very helpful.
Yeah.
Well, thank you so much for coming on today and sharing all this great knowledge with us.
My pleasure. Thank you for asking such great questions.
Oh,
that was fun.
Okay, so it's time for us to start using that observer self. Actually, much in the same way we did at the end of last episode. So if you listen to that one, you're probably already a bit familiar with this. What did you get out of this episode? Just one or two takeaways. I know that for me, it's noticing what's going on with my body by using that observer self and then building the right healthcare team to treat it. I wouldn't have thought of a dentist in helping with migraines, and yet it sounds like that might be someone who can help if you find one with the right specialties. What have you noticed about your own thoughts and feelings as you listen to this episode? What are you noticing now as we do some reflection together? Make sure you check out Dr. Shirazi's website for more information and tag me on Instagram with what your takeaways from the episode were. And don't forget to subscribe, rate, and review the show wherever you get your podcasts and share this with friends who might need to get some insight out of it as well. Also, I totally appreciate any support you have for the show by following the Patreon link in the show notes. Until I talk to you next week, keep making the most of it. Special thanks to Nicole Skira for the original music and to Charity Williams for the original artwork.